any second
We
now.
are now live.
Hey everybody, welcome to a special Thursday edition of Kicking It with Kerry. I'm here today with Dr. Robin Lewallen. She's a board certified dermatologist, and we're going to be talking about something that affects so many people. And I've never really had problems with my hair. I've been very fortunate, but the two things I've noticed in the office that people get the most worked up about, and I've never seen people as upset as if they have really bad cystic acne and they, are struggling and suffering, or just they have clear skin and they start to develop acne. They get really upset. And then people who experience some sort of hair loss. I don't know. I think people are emotionally attached to their hair so much. Mm-hmm. I'm not exactly sure what it is that causes them to be so upset, but when they start to get thinning or they get some bald patches, it's kind of like the worst thing in the world that I think that's happened to some people. So what do you think causes that much anxiety and stress for those patients that are going through something with hair loss?
I would agree. I think some of my most emotional kind of visits are usually hair loss visits.
Yeah.
I think it's part in, what your face and your hair is what you put out into the world, and it's what you are kind of known for, and your look is highly defined by your hair. Mm-hmm. And same for acne, where it's highly defined by your face.
Yeah.
So I think that people get really attached to their hair.
Yeah.
Especially people that have had really thick, full hair their whole lives, and then it changes over time or changes rapidly because of some reason. Mm-hmm. It's pretty distressing to people. And a lot of times they want to know what the internal reason why it is, because it's so distressing when clumps of hair is falling out.
Right. So with that being said, I'm going to close this door because we're doing business in the other rooms, and I hear beeps and lasers and buttons and things, so a little distracting for me. So I know you've had great success with helping people through this trying time for them. What's the first step usually? Like when you see somebody who's had a full thick head of hair and then they just start to gradually have some thinning, I guess there's a number of things that happen. Either they have gradual thinning, or they're getting clumps out, or it's a lot of hair loss all at once. So I guess what's the first step when they come in?
Yeah, for me, so I used to run a hair loss clinic in the Bay Area for 2 years.
I didn't know this.
Yeah, I had a hair loss clinic when I was up there. So I formulated like a questionnaire that gets to the bottom of a lot of the hair loss issues even before I see them. Uh-huh. So doing that questionnaire with the history and, all the hair care practices that they do really helps me to narrow it down as to the type of hair loss that they have even before I go into the room. So it really helps to direct the visit and make it the most fruitful for everybody.
Right.
And then the next step is kind of going over that questionnaire with the patient, making sure that everything is filled out accurately. A lot of the questions have to do with what type of hair loss I think that it could be, but also there's a lot of questions directed towards the treatments that they could be candidates for as well. So like if they have history of breast cancer, it really limits the number of treatments because of the hormonal aspect of a lot of the hair loss treatments. And then the exam is very important too. So that's kind of the next step after the history and the questionnaire. And the exam is also extremely important because there's two main forms of hair loss. There's scarring and non-scarring hair loss.
Okay.
So when you look at the scalp, you want to know which one of those two categories that you're in. Most of the time for non-scarring hair loss, you don't need to do a biopsy. Mm-hmm. A lot of the times for scarring hair loss, you don't need to either, as long as you know exactly which one based on how it looks. Okay. But that would be the main reason why you might want to do a biopsy to further classify the type of hair loss. And then after that, usually I do labs for a lot of the non-scarring hair losses. The non-scarring hair losses, the most classic would be like male or female pattern hair loss, that kind of slow aging related thinning, or telogen effluvium, which we see a lot related to COVID and stress.
Telogen effluvium.
Yes. Telogen effluvium. So that one is one of the ones I've seen a lot in the past year.
I've never seen telogen effluvium.
Never.
I don't think so.
I probably see it like once a week.
Really?
Yeah.
What does that mean, Dr. Lewallen?
So there's 3 phases of the hair cycle. There's catagen, anagen, and telogen.
Okay.
And telogen is the shedding phase of the hair cycle.
Okay.
So usually about 90% of the hair is an anagen or growth phase.
Okay.
And then there's between 5 and 10% that's supposed to be shedding at any point. That's why we lose hair every day. But when you switch into telogen effluvium, that means most of your hair, sometimes 40 to 50% of your scalp, can be shed pretty rapidly. So you see clumps of hair falling out from the stress.
And you would see that during a visit, or is it that you're doing the exam and you're actually, maybe giving the hair a little tug, and then if it comes out, that's
exactly, yeah. So there's like a hair pull test that we do.
Okay.
So it's like one of the tests that helps to diagnose telogen effluvium.
Okay.
So we don't even need you to go to medical school. You got it.
Yeah. Okay.
Yeah. So there's a hair pull test that we do. Usually, you try to get somewhere between 20 to 30 strands of hair between your fingers, and you pull, and it's positive if there's about 4 to 5 hairs in a pull. So I do hair pull tests in almost all patients that I see for hair loss. If I can tell it's a scarring alopecia, then I don't, because there would be no reason to try to pull. But if it's non-scarring, then I'll pull to see if they have a major shedding event happening.
So if it's non-scarring, just kind of age-related, what would be the treatment? And then on the other hand, if it's that telogen effluvium thing, where would we go from there?
Where would we go from either one of those?
Yeah.
So in the non-scarring category, there's 3 main types. So there's the hereditary or female pattern, male pattern, slow aging related. There's telogen effluvium, and then alopecia areata, which I'm sure you've seen that.
I have seen that.
That's like the big patches.
That one I can diagnose.
The big bald patches that occurs from stress as well. So those 3 all have kind of different treatments that you would do. For the age-related one, a lot of times I'll do labs. So there are some labs that have been linked to age-related hair loss. So people that have iron deficiency will sometimes have worsening regrowth. So if they're iron deficient, I like to replete that. Zinc deficiency has been linked to hereditary hair loss too. Supplementing it hasn't been shown to cause improvement, but if it's deficient, I usually do try to supplement it back to normal.
Pause.
Yes.
What's a normal amount of hair loss? Like, I'm 50, just turned, and I think my hair has thinned a little. Not like it's actually been sort of a good problem because it's easier for me to do it. But if I went too far, what's a normal amount of hair loss for somebody entering their 50s?
So the amount of hair shedding is the same no matter what age you are, really.
Okay.
The age or the number of shedding hairs ranges between like 50 to 100 in individuals, no matter what your age is.
Okay.
So some people are more heavy shedders. They might be more on the 100 side of things, and then some people might be more on the 50 side, but that's the range.
Okay.
That's normal.
All right, so we can get away from me and we'll go back to where you were.
So with age-related or hormonally related hair loss, I do check some labs, like I said. So zinc and iron are the 2 most common that I might check. Vitamin D deficiency is also linked to hair loss, so I also do check vitamin D in those patients. And then there's some other ones that I might check depending on the patient's history from that questionnaire, like thyroid or other kinds of things. And then going towards treatment for those patients, the most classic is Rogaine or Minoxidil topically. That one's been around since at least the 70s. It's available in 2 and 5% over the counter. Both 5% is FDA approved for men and women, so I don't ever really recommend the 2%. So go bigger,
go bigger or home. Exactly.
Yeah, if you're going to put that on, then you might as well just do the higher strength one. And then oftentimes, if people tolerate the 5%, then I'll compound higher solutions for them that are prescription grade products. So that's kind of the first one. With the most evidence, there's a randomized twin trial for Rogaine or Minoxidil. So they had a set of twins, both of them applied. One applied placebo, one applied the Rogaine, and they had to end the trial early because the twin that was using the active knew. It was obvious.
Yeah.
So it definitely works.
Bunch of hair there.
Yes.
Okay. And the other twin's like, that's not fair.
That's not fair. Give me the real stuff.
Give me some of the drugs. Yeah.
Exactly.
Gotcha.
And then next up from there, in men, there's an FDA-approved treatment called Propecia. Propecia is a 1 milligram finasteride. So that's used on label in men. It's used off label, not FDA approved in women a lot of times, but there's no clinical study trial data for that, but we use it often.
Okay.
For a female pattern.
And are both of those over the counter?
Finasteride, no.
Okay.
Both of those are prescription.
Okay. Isn't there some sort of hair supplement that's over the counter, not Neutrophil, but something that people that they used to not be able to get that they can get now?
So similar to finasteride, you can do saw palmetto,
Okay.
and saw palmetto blocks DHT or dihydrotestosterone, which is what causes some people to get age-related shedding. It's the same, like Neutrophil also has saw palmetto in it.
Right.
So that would be an over-the-counter option that people have used. And then there's pumpkin seed oil that has some evidence for it too. That's over the counter.
Okay.
It also blocks DHT.
Now, if I'm, 26, 27-year-old male and I have hair and I'm starting to see, hey, I'm starting to look like my mom's side of the family's dad. What can I do? I still have hair. How do I stop it from going away? What do I do?
Yeah, for me, that's the ideal candidate, the person that still has a lot of hair that I try to maintain.
Right.
So for that, I would do topical Minoxidil 5% once a day, potentially doing Neutrophil or doing Propecia, and then platelet-rich plasma injections. The younger you do platelet-rich plasma injections, I found the better it works. So platelet-rich plasma injections where we draw your blood, we spin it down, we get the good growth factors and nutrients from it, and inject it into your scalp. The younger you are, the more growth factors you have.
Right.
So it responds a lot better than when we do it into older patients.
That's a lot of work, though. Like if you start doing that when you're 26 and then But
a lot of times people will do it because they do the 4 initial treatments, and then they just do annual maintenance injections.
So you would do the platelet-rich plasma, and then maybe not worry so much about the Minoxidil and the Neutrophil, depending on their budget. What sort of
the
energy they
go
want
big or go home. The more you do, the more it works.
Does it store up? Like if you were to start the treatment early, and then you're doing it, like could you stop at some point or no?
You always can. So they're progressive diseases related to hormones. So if you stop, then you would just start progressing. It's kind of like if one day you decided to stop brushing your teeth, they would start to decay. So it'd be the same type of thing. You're not worse off than if you never brushed your teeth, but...
Yeah, I wouldn't try that.
Yeah.
You guys keep brushing your teeth. Keep brushing your teeth. Okay, so you also mentioned alopecia areata, which is when they have the patches of hair loss, and you said it's stress related?
Oftentimes it can be stress related, and I think Kate might have a picture of that one. It's the one with the big bald patches. So in that one, a lot of times it's stress related, but it's also an autoimmune condition. So that one, depending on the degree of severity, you can do just topical therapy, which is a lot of times where I'll start in kids. It's a really common condition in kids, especially during, if it's finals time, sometime around May, you start to see a lot of kids that come in with alopecia areata. Or divorce, a lot of times you'll see kids come in.
Bobos.
Yeah. So it's a lot of times those stressful events that you can get and you can find out, and that's usually the trigger. And then if it's pretty mild or smaller spots, I'll start with topical treatment, like a topical steroid to calm the inflammation down, or even Minoxidil to help regrow the hair. If it's more severe, then a lot of times we'll do injectable steroids or oral steroid treatments, or there's some steroid oral treatments that are in clinical trial that I've used off-label as well.
Yeah.
So it's still undergoing FDA-approved trial, and it definitely has lots of literature evidence to support it. It's just not FDA-approved yet.
So I doubt there's many 13-year-olds watching this, this broadcast. So moms, dads, if you see your child that is having, you notice a little bald patch, get them in sooner rather than later so we can help, take care of that before it becomes a bigger problem. What happens if they don't get treatment?
So a lot of times as the stress of their kind of school goes away, then the hair will regrow, sometimes spontaneously. So some people will do fine with no treatment whatsoever. But some people do progress, and some people progress to be their whole scalp or whole body. So that's called alopecia totalis when it's the entire scalp, which was what the photo was of. That patient had totalis. She lost her entire hair on her head. And then there's universal, so you can lose your entire body and scalp hair from it. So
may not be so bad for some people.
Yeah.
I mean, the body hair.
The body hair, yeah. That's the only positive.
Thank you very much.
The only positive aspect of alopecia totalis, for sure.
Yeah. So in the office, let's talk about, you kind of mentioned some of the steroids, some of the topicals, some of the medications that can be prescribed. What in-office treatments, well, I guess PRP, but is that the only in-office treatment that we can do? And maybe let's talk a little bit more about PRP.
For alopecia areata specifically?
Or for hair loss in general?
For alopecia areata specifically, there is some study evidence that PRP does help. So if people wanted to avoid steroids, some people really want to do just natural approaches to treatment, that could be an option that they could do. And then we do intralesional injections of steroids for people with alopecia areata as well. So that is helpful. And then in-office treatments for telogen effluvium, there's evidence that PRP helps with that. All the non-scarring alopecias really can do great with PRP. So that's a good option for aging-related, telogen-related, or alopecia areata if people want to do a more natural approach.
And I'm sorry, you talked about non-scarring. Is the alopecia areata a scarring one?
That one's a non-scarring one.
So what's the scarring kind?
Scarring kind might be a lot of names that you've not heard of, but one that you definitely would have heard of is like lupus.
Oh, okay.
So lupus causes a scarring alopecia. You might have heard of sarcoidosis. That one causes scarring alopecia. Lichen planus, which is a common skin condition, can cause hair loss, and that one's scarring in nature too.
And are there treatments for those?
There are treatments for those, but it's tougher. The sooner you get in with those, the better off you are, because it's hard to grow hair in a scar. So the scarred area may never recover. It's making sure you don't get more or new areas of scarring. That's the goal of treatment. And then any growth that I can get beyond that is always ideal. But the sooner you come in and we can halt the scarring process, the better.
And basically the patient would know whether they have scarring or non-scarring at that initial appointment because you'd be able to tell them?
Correct. Yeah, you might not be able to tell them which form of scarring they have because you might have to do a biopsy to know.
Right.
Most of the time I don't need to, but there's kind of rare occasions where lichen planus and lupus can look very similar, in which case you'd want to do a biopsy to determine between those two.
This is all so fascinating. I have more questions. If any of you have questions and you're watching live, please feel free to ask us. We will try to accommodate any questions you have. So we talked about platelet-rich plasma. We talked about some of the other, treatments. Are there anything else that we haven't mentioned yet that we do in the office?
We do the Neutrophil Supplementation. So we have that. The reason why we carry the Neutrophil line is because it has the most study evidence behind it of any hair loss supplement. So one of the most common misnomers or kind of false facts about hair loss is that biotin helps.
Yeah.
So
everybody knows about biotin.
Everybody knows about biotin, but none of it's true.
It doesn't work at all. It doesn't help anything.
No.
Does it help your skin and nails?
It helps the nails.
Okay. All right.
But not the hair at all.
Not even the glossiness of the hair.
No.
I gotta go throw that away. Just throw it away.
Yeah, so if you're gonna do a hair loss supplement, almost all the hair loss supplements will contain some biotin because, most people want to buy a hair loss supplement that has biotin because they've read that it helps. So even the Neutrophil has a low level of biotin in it. But there's no study out there that proves that it works.
It's kind of hard for me to believe that, a little vitamin can really help with your hair loss. So what's in this one that makes you believe that it's worth what do we charge, like $89 a bottle for a 1 month supply?
Yes. So the main one in this one that I think is kind of the most evidence-based is the saw palmetto. So saw palmetto blocks DHT. There's also evidence for vitamin E. There's also evidence for zinc, especially if you're deficient. There's evidence for vitamin C as well in some patients. You don't want to go overboard, but vitamin C helps to you do absorb iron, and iron is one of the more common causes. And then vitamin A in low levels can help. Vitamin A in high levels actually makes you have hair loss, so you really don't want to go overboard with that.
Right.
But a deficiency can cause it. So it kind of repletes the ones that are the most common if you had a deficiency to cause it. And then it has some that do help promote growth. It also has some L-lysine in here, which helps with iron absorption.
So you truly believe in this product?
The reason why I truly believe in it is because it has a randomized controlled trial that showed it worked.
Yeah.
If it didn't have that, then I wouldn't. I'm very evidence-based.
Yes, as you should be,
So
you're a doctor. Yes.
So if there was no evidence behind it, then I wouldn't. Yeah. So, I mean, like with biotin, there's no actual study that shows that it helps.
Right.
The reason why it can put it on the label is really the labels aren't FDA regulated, but also because there's a rare genetic disease. If you're born with the inability to make biotin, then you can't grow hair. But that's like an extremely rare
If you've
disorder.
got hair, then you probably don't have that.
You don't have that.
Yeah.
Yeah. If you were born with hair, you don't have that disease,
Right,
and
right.
you don't need a biotin supplement.
Right. Wow.
For hair
I
loss.
wonder who made all that money on biotin.
A lot of people.
A lot of people made money on biotin.
Yeah.
So
Well, they're still probably the most popular hair loss supplement.
yeah. So Neutrophil is available in our office, and you can buy it online on our website. I don't know where else they sell it. I think it's only in medical offices, but I'm not positive because I've seen ads on Instagram actually.
Yeah, I think you can buy it direct from their website, but we do a better deal than they do when you do the 3-pack of it.
Yes.
And then you can buy on Amazon, but I would never do that because there's false.
Yeah, just so you all know, if you are a big Amazon consumer, Amazon's great for a lot of things when you get it direct from the manufacturer.
Oh, I buy from Amazon almost every day.
Yeah, I mean, it's
But
awesome.
nothing I would eat.
Nothing you would eat.
Yeah.
Well, I think Lisa just filled our snack cupboard with stuff from Amazon.
I'll get it from Amazon Fresh. Amazon Fresh I will do.
Oh
but
my
I'm
gosh.
saying like a supplement.
A supplement.
I would
don't
not
go
buy
there.
a supplement.
And I wouldn't buy
Yeah.
Obagi or any of the medical grade products that
I
we
wouldn't
sell.
buy a sunscreen.
No sunscreen either from them.
No.
Just, yeah. So just food for thought. I'm just
Who-
putting it out there.
Who would
you're
knock
kicking
off
it with me.
sunscreen, but a lot of people do apparently.
Yeah, I know. So, are there any other questions? I am assuming no. We'll put this on Instagram for you guys to watch later. If you have any questions, please let us know. Dr. Lewallen also has a blog. It's not her blog, but there are posts that regard hair on our website, and that resource is one that I don't think people use enough. There's some really great information on our website in the blog section. I mean, our whole website, but if you just scroll down to the bottom. So, do you have anything else that you wanted to add? Because I don't want to. Maybe I forgot to ask a tough question.
No, I'm almost done writing a blog post about like nutraceuticals and supplements for hair loss as well. So that would be up maybe in the next couple of days.
Oh my goodness!
Good
there
job.
you go.
You didn't even know I was writing it.
First to know. All right, guys. Well, thanks again for joining us. I don't know when our next episode is going to be, and I don't know what it's going to be about. So I'm open to suggestions. Please send them my way. Thanks for joining us.